Hey everyone, it's Jet with Pancake Farms. Today we are out here at Broken Top Veterinary Clinic with this little guy here. We'll see if we can get camera focus in on him. This is Ollie, and for some reason he is having some issues. And so we're gonna try and find out what's going on with him. He's acting real weird. So down here you can see that his penis is out. It is fully covered in dirt. And so we're going to find out what they want to do, whether it's a urinary blockage or whether he just got stuck outside of his sheath and needs to be put back in. But those are a couple of the options the doctor is going to be looking at here in just a minute.
Ouch, mister. Alright, so I need a lot of the Huck towels and warm water.
So what's the difference between the red and the black brown?
I'll run in to get warm water.
Is that dirt or?
It looks like dirt. Yeah, go ahead.
Okay.
Yeah, that looks like dirt.
Okay.
And as soon as we get that all pulled off, we'll see exactly what's... I know, that hurts, huh? See exactly what the color of it looks like underneath.
Okay.
So he's pretty swollen here. Yeah, it's cold.
So now with having his penis out like this, I mean, would that cause him to shiver potentially?
Well, it certainly is painful, so a lot of the times animals show pain by shivering.
Okay.
And sometimes these guys, if their extremities are cold, like having a penis out and it gets cold, it can make them a little bit on the cold side too. So there's a couple of things that it can do. I know, I gotta touch it. I'm sorry, I gotta make sure all that feels good too.
Because we were hoping to breed him, but
Okay.
we obviously may not be doing that.
And I'm sorry, I heard you were a wether, not a ram.
Aw.
I'm sorry, mister. Okay, but his heart sounds good. I mean, his heart rate is actually pretty darn good for having a penis out. Sometimes I hear that their heart rates are a little bit more elevated because of the pain. Let me see here. I'm just gonna turn on. And listen to your gut sounds, kiddo.
Now what would be signs if there was a urinary blockage?
Very similar to what we see now. Not peeing, very down, not wanting to fight, that kind of thing. Until it ruptures, then it's, oh, I feel better. And then they die the next day.
Gotcha.
So.
And the only way to solve that's catheterizing them, or?
A lot of the times, other times is that we can take a look at the end of their penis and see, are there stones right there at the end of the penis?
Okay.
Or if there's an extra piece of skin that just needs to get cut off, exactly. A lot of the times it's hard to actually feel the bladder because of their rumen and all their guts in there.
Right.
So let me grab some gloves and alright, I'm just gonna start working at the tip here and make sure we don't have anything nasty.
Alrighty.
Like any stones.
So what would cause stones?
Their diet. So what kind of food are you feeding these guys?
Grass hay or a grass alfalfa mix.
So they're not getting any grain or anything?
No, we do have mineral out for them.
Okay, perfect.
You need light?
I do.
How can I help you with that? With the portable one right here?
Yeah.
So, I mean, with small sheep like this, alfalfa, grass hay, all call that fine for their diet?
Yeah, depending on what we find, certainly I worry about the alfalfa because it can be a little on the rich side of calcium, and that can cause stones,
Okay.
especially in the males. But certainly we do have things to go along with that.
This is close enough.
For, let's say,
It's gonna be bright.
Okay.
ammonium chloride to help with all the acidifying the urine and making it to where we can prevent stones from forming.
Got it.
So you can add that to, like, on top of their,
You need a bucket? What else do you need?
I know, kiddo, come here, kiddo. On top of their hay,
Okay.
and that should help with,
They're just difficult.
I know, mister.
Is that enough light? You wanna?
No, that's plenty. Can I
Yep.
get more hug towels, please?
Yep.
So he does have feeling, but I worry about this black tissue. Can I get the sugar, please?
So should it be basically a clean cylindrical that goes from wide to narrow point, or should it be, because that looks kind of funky to me.
It does look funky.
Boy.
I'm not seeing. Oh, some of this can be because of being out. He's got a lot of damage to it.
Okay.
So
This may have been out more than what I noticed yesterday.
it's very possible because you see all this black.
Yep.
That's almost necrotic to where the blood hasn't been to it for a while.
So what's that part that you're pulling on?
That is the little extra piece of tissue that sometimes can cause some blockage. And due to all his swelling, I can't quite see his urethral process, his urethral opening. Can you pour some sugar on there?
And so the sugar helps how?
It's an osmotic, so it'll pull all the fluid, all the edema out. So we do this a lot on the uterine prolapses, rectal prolapses, because it's been out, it builds up edema, so a lot of fluid in the tissues. And so what the sugar is supposed to do is it's supposed to help draw all that fluid out and decrease all the swelling.
Cool. And that's just simple powdered sugar.
Simple powdered sugar, yeah.
You look rather comfy. So not that I like the sound of saying it at all, but do you cut off that part of his penis that's not living?
Yeah, usually we do, and a lot of the times we have to sedate them heavily or anesthetize them in order to do that, because it is a painful thing.
So if we were to cut that off, would he still be able to breed?
He may not be able to.
So it's sounding like we may take good care of you so that you become a very good table dinner.
Just seeing where we are. It's gone down a little bit.
So if this was normal, would you just be able to basically pull and push and it would start contracting back in just like a normal
Yeah, usually
penis?
After doing a little bit of the powdered sugar, they usually just shrivel back up and go right back into the prepuce without much effort. So we're going to try just a little bit more, but I am worried about what this looks like. But it has decreased in size a little bit, at least. Perfect. Well, that's a lot.
for the future, if we notice one of them's been hanging out for more than a day, pull them in, flip them over, put powdered sugar on them, rinse them off.
Yeah.
More than a
And
couple
then-
hours.
More than a couple
I
hours.
wouldn't let it sit out for a whole day.
No,
Okay.
if,
Yeah.
if you see it stuck out, I would try and get it back in as soon as possible.
Yeah, I wouldn't leave it.
So then how long does their, like, because right now you can tell their lips are moving, they can smell the girls,
Yeah.
you know, they're sticking out full erect. That normally lasts, because I mean, we're seeing a lot of that right now. So
Oh, I'm sure.
that should be, what, out for 10, 15 minutes, and then they should calm down, and then,
Yeah, I would check on them in a couple of hours and
Okay.
see, but also look at their behavior too. If they're just standing there, not looking at the girls, and they're still out, and then check them in an hour, and if they're still out, then that's when I would definitely try and get them and put sugar on them.
powdered sugar treatment.
Yep. And if they are dirty, I would wash them.
Okay.
And then once
Normal
you-
water, just fine?
Yeah, normal water is fine, warm, to get off all the dirt. And then once you get the powdered sugar and stick it back in, then I don't know if you guys have saline at all.
Not on hand right now, but that can always be fixed.
Yeah, so usually I flush their prepuce out tremendously with the saline.
Okay.
Just
So
to
just all of
keep-
the opening area, all of that, okay.
Yeah, and if I can get this one back in, I stick this syringe actually in their prepuce and just flush as much as you can.
Okay, so basically, as it goes back in, rinsing the entire sheath out then.
Yeah.
Okay. He was laying down quite a bit yesterday when we were trying to get one of the Jacobs, and he was just kind of laying off to the side.
Yeah,
He wasn't
yeah.
running around with the herd. I was like, something's not
Thumbs
right.
up. Yeah, you're right. Uh-huh.
What are other common things to watch out for? That's better.
So it's more
Good boy.
on these guys. The two common things I see are blocked bladders and then
Just hanging out.
Straight penis.
the other things are lacerations to the penises. So if they try and go after a girl and then kick at them and catch their penis, they can get some lacerations from that. And those we would probably sedate and stitch up and then put them on antibiotics to make sure that they don't get any infection, because that's a sensitive area.
As far as the scrotum and testy sac and all that type of stuff, anything besides lacerations really that happen there? Or normal versus unnormal feelings?
Usually you want them symmetrical, you want them kind of soft. He has really nice ones. Basically, they're nice and symmetrical. They're the same size. And they don't feel, one doesn't feel rock hard, or the other one feels puny or very, very soft. So that's kind of, this is ideal.
Cool.
Good boys. You didn't eat today, or he did?
Not that I've seen. He stayed away from the food this morning.
Yeah. Doing all right. We're still trying with the sugar.
Let's see if we can. So this side is definitely decreased in size.
Mm-hmm.
That little one is just a little bit more bulgy. So I put a little bit more of the sugar on that.
Okay.
So you just kind of grab the edges of the prepuce
Okay.
as it shrinks down, and usually it just kind of pops right back in. So already part of it has, oh, stop. Yeah, so that's a big improvement right there.
Yeah.
Okay.
So we could probably get it back in, but like I said, I'm really worried about the tip of his penis in some of these darkened areas where the blood supply hasn't been there for a while.
So for that to happen, for it to go black, basically it has to have lost blood for how long?
Like that, I would say anywhere in between 12 and 24, maybe 48 hours.
Oh, really? Okay.
So, yeah.
So it's not like, oh, it's been out for a week and you just didn't notice it. It's
No, I mean, if it was out for a week, the whole thing would be black.
Yep.
I know, big guy. Hold on. No, just let it go back in. I know it probably hurts, kiddo. So we can. I'm gonna start seeing that there's color coming back underneath here. See how red it's getting?
Mm-hmm.
So that's color coming back. So I'm okay with it going back in to his prepuce with the sugar on there. That's why I really flush it out afterwards.
Okay.
I think so.
A little bit. It's like,
Just a little bit. Just a little bit too much edema.
So you're just trying to kind of squeeze and compress it down.
yeah, I'm gonna see if he'll let me, but. Just trying to help him.
When the skin goes black, could that basically seal off the urethra opening then?
That's what I'm kind of worried about. Oh, sorry, can't put hair on there.
And I need to step up before you get into that because my leg's
Yeah.
falling asleep.
Go for it.
Oh. Oh, okay. That's better. So really those bulbs sticking out should not be there at all.
No, they shouldn't.
Now it's more mottled as opposed to completely blackened. Good boy. Yeah, he feels that.
So can they, I guess, actively pull it back in then?
Yeah. Alright, let's see.
You're doing a good job.
Okay,
So
so I can
it feels
see
like
some red
improvement.
coming back in that black
Yeah.
area.
Yeah.
So it's potential that he may end up being okay.
It's
Potential.
Yes.
Not, no guarantees.
Exactly. Because
you-
the main reason why they're out is and stay out is because they have all that edema.
Edema.
Yeah.
Which
So
clearly is not gonna
explain edema a bit better.
So edema is basically a lot of the tissue swelling. So the tissue fills up with fluid.
Right.
Kind of like if we hurt our hand and our whole, like if we broke our thumb and we get all that swelling, that's edema or
Okay.
cellulitis. So what happens is when their penis stays out for a while, they get a lot of fluid in the tissues. And so the idea behind the powdered sugar is it draws out all that fluid and decreases the inflammation. Yeah.
So we've gotten a bunch of really good information. You know, if we start seeing it out, what to watch for, how to treat it
So probably
before
not
it gets to this stage.
not to breed him this year, or
I wouldn't. No, I would let his penis.
We've been talking,
Rest.
he might even need to be table dinner.
oh my goodness, really?
Yeah.
So it's not working, or
No, it's working to a point, but he has some dead tissue that.
It's
It's not
chop
good.
off part of his penis or just go ahead and end it quickly and take them to this. Yep, the slaughterhouse.
Oh. And it happens a lot in the younger guys. Just because of the inexperience that they have.
What, buddy?
So was it out more than this? Was this actually in a lot comparatively?
Maybe a little bit, but
Not a whole lot. The size is a lot less though.
yeah.
Yeah.
And the color is coming back a little bit better. See that this part here, that was more black. And the color is starting to come back a little bit better. But all this black tissue, that might fall off, especially this stuff up here.
Oh my goodness.
So I guess the question now remains is how much longer do we want to keep trying to put it in or call it?
Right.
Just powdered sugar. Well, after this one, if it doesn't work, let's call it.
Okay.
There's no, I mean, this will be our 5th attempt.
Yeah.
Oh wow, that's even down more.
Yeah.
So I'm guessing that hair is not growing on the inside of the sheath then.
No, this is just,
It's just still sticking out.
yeah.
I think we work on calling the slaughterhouse at this point.
I think so. I don't think it's gonna get any smaller than that.
So typically if you catch this and it's only been that way for an hour or two, you just powder sugar, it goes back in and everything's fine.
Yeah, pretty much.
Look at you, a cute thing. How's it going, guys?
I don't know that
We're
it's
gonna
done.
call
We're
the
at a
slaughterhouse, I think is our decision.
Okay.
Yeah, it's a standstill.
Yep. Alright, looks like we got a few on there. I'm gonna go ahead
Yeah, go
and start walking.
Okay.
It's your choice to go in.